Hello, thank you for joining us today. The presentation will begin in approximately 5 minutes. Thank you. Hello, my name is Stephanie Toddy from ExamSoft, and I'd like to welcome everyone to our webinar today entitled Nursing Student Remediation Made Easy with Embedded Assessment, hosted by Laura Logan, MSN, RN, CCRN, instructor, DeWitt School of Nursing at Stephen F. Austin State University. Laura Logan is currently a full-time nursing instructor at the DeWitt School of Nursing at Stephen F. Austin State University. She currently teaches care of the complex client, critical care nursing, to approximately 120 students per year. She is also a consultant with Evolve, Lippincott, and F.A. Davis on several projects related to nursing content, remediation, and curricular design. She has taught basic care of the adult client, family violence, the nurse's response, and pathophysiology. She is a graduate from Lamar University and Texas Christian University. Her career passions are student success and critical care nursing. Before we begin today's presentation, I have just a few housekeeping items to go over. If you have specific questions throughout the webinar, we encourage everyone to type them through the questions feature of the GoToWebinar control panel, which you should see on the right-hand side of your screen. You can type these in at any point throughout the webinar today, and we will have a chance to answer all questions at the conclusion of the presentation. Also, at the conclusion of the presentation, you should have a quick survey pop up for you. We encourage everyone to fill this short survey out if at all possible, so we can continue to provide relevant content at all of our presentations. If you're interested in viewing past webinars or registering for upcoming events, you can view an entire list at www.learn.examsoft.com/resources. Today's webinar is being recorded, and all attendees and registrants will receive a follow-up email with a link to the recording in the next few days. Please feel free to share it among your peers as you would like. With that, I'm going to go ahead and turn everything over to Laura. Thank you so much for attending today's presentation. Please enjoy the webinar.
Hello, I'm glad all of you are here. Looking forward to dispensing a little bit of information here. It shouldn't be a long webinar, but hopefully we'll get some good information and you can apply it to your nursing time with your students. Here's me. I thought maybe you might want a picture to go along with the face. That's my husband, but yeah, that's me. So you can kind of see what I look like. It's kind of daunting to hear just a voice and not have a face with it. So there I am. And to start off, I just thought, well, you know, we really need to talk about expectations of our students. And I'm sure a lot of this information that I'm going to be giving you, part of it you probably, already do, but hopefully there will be some information that's new to you. First of all, we want to make sure that we inform our students of the expectations that we have for them. There's nothing more frustrating than thinking you're doing the right thing and being completely off guard by that was no more where you were close to than anything else. So, making sure that they know that, the passing score is 75 or greater or whatever your passing grade is. I use examples on this in this webinar that are, from my experience. And then I tell my students all the time, because many of them are extremely anxious about math, that they should expect the drug calculation question first. We randomize our questions, so that's not going to happen for every student, of course. But we don't know which one it's going to be, and they don't know who is going to be the lucky person. So, I tell them, expect that to be your very first question. And that way, their anxiety goes down when they first get it. They go, oh, I expected this, so it's not a problem. And I tell them all the time, a lot of anxiety can be reduced if you study, if you do what you got to do. And I tell students all the time that 75% of the work comes from you. 25% really comes from me as a faculty. It's not a 50-50 thing, in my opinion. I think that they really have to do more work than I do, because I've done it for several years. And not that I'm not open to new things, I am definitely open to new things, but usually they're not as difficult for me as they are for them. This is new material for them. They're in a totally different growth and development than I am in. So it's just going to help them a lot if they know that they're really going to have to work hard to succeed. Okay, so where do we start? When you think about remediation, we require that at Stephen F. Austin in our nursing program, we require that the students who are at risk or who have failed an exam, need to come and speak to their clinical instructor because we have so many students in per course that we divide them out that way. And we encourage them, strongly encourage them to come no later than, before the next exam. Because if they're making mistakes that can be corrected, then we want to correct them before the next exam. So, how do we do that? How do we know what mistakes they're making? Well, hopefully I'm going to help you kind of sift through that. First of all, ExamSoft has a great report called Opportunities and Strengths Report, and it shows the student and the instructor, depending on how you categorized your questions in your exam, which ones are they, doing well on? Which ones are they needing assistance on? Maybe one of them is average, and it can be categorized according to topic. It can be categorized according to, our Bloom's taxonomies. It can be, categorized according to even down to, maybe it's a cardiac question, but it's a hemodynamic question. And if you're even going deeper, it's, a treatment of hemodynamic parameters or profiles. So you can, really drill it down to what specifically they are missing if you categorize your questions in that manner. So if you haven't done that, and I have to say I haven't done that to drill it down to that point. Right now they're pretty broad, but that's one of the goals I have this semester is to take the questions that I'm using and subcategory them a little bit more so that it can help my students see where they're missing what they're missing. And then after each exam, the students are required to complete an item analysis form. It's called a test item analysis form. And it's not the same kind of analysis form we're used to seeing after we give an exam. Here's an example. This is the one that we use. It wasn't created by me. I'd love to take credit for it because I've used it and I think it's a great tool. But someone else did, and I don't have their name. I do have a credit at the end of the process, at the end of the program that does give credit to where it says on the form we got it, okay? But it's a pretty self-explanatory form. I really encourage them to put their name on it and their clinical instructor because that's who's going to get this form. The date, what test it is, what they scored on, and as you may know, that when they take an ExamSoft test, a lot of them just are so either they're excited that they did well, or they're on the other end of the continuum where they're depressed and sad and all of that, and they get up and don't upload their exam. So that's just a little prompt there. Okay, so that's the top of the form, obviously. Then if you'll see question number, that and I guess that whole column there, it stretches downward, and then across the page you have squares. And what the purpose is for them to put their question number on at the end when they go over their rationale at the end of the course. At the end of the test. So say they miss question 5, all right? And they put question 5 right up here in the very first box. And then they read the question, and they read the rationale, and they think, well, why did I choose what I chose? And some of these prompts, 1 through 12 over here, and there's one more that unfortunately didn't really show very well in the PowerPoint slide here, but it says other. Oh, it does say other. I'm sorry. There we go. Other and vocabulary. So sometimes it's very simple. Other, I always say you need to identify what other means whenever you're doing it. So let's say, for instance, they read into that question. And maybe the next question they look at is question 6. And they missed, let's see, I think there's one here that says missed words and skipped limiting words, that kind of thing. So clues in the stem or the answer. So, I have them go through this. It doesn't take long. Trying to get them to do it can sometimes be a little bit of a struggle. But once you get them to buy in to see how it can help them by, it's an assessment, right? So it assesses their thought process and their thinking about why they chose what they chose in the answers. I really stress that they do it. I talk about it at the very beginning of the course. And the ones who don't do it, I have to say, are usually the ones who need to come in for remediation after the first exam. And I ask them, help me understand why this wasn't completed after your exam. And a lot of times they just say, I just really didn't want to do it. Well, I'm sorry you didn't want to do it, but here we go. Well, this is the first step for me to help you, and we're handicapped because, I don't know exactly what you were thinking at the time. And they try real hard to recall it, but, they can't remember. So, again, after that first test, they usually buy into the fact that it's going to help them. I guess we're creatures of learning from mistakes, and that's okay. Hopefully it's not too bad of a mistake the first time so that we can go further and be able to help them in the long run. All right, so this is a tool that I use, and you are welcome to use it as long as you get permission from the credit I'll show you at the end. I don't think that the entity will have a problem with it. We've never, they've given us permission. I can't imagine any other institution having a problem with it. So, or you can make your own. It's very similar. You may have better ideas, or your student population may have different prompts or reasons why they are missing the questions. Okay? So we're going to use this tool in the next couple of examples, and I'm going to show you how I remediate the student and what I have gleaned from this type of tool that we have. Okay, the first example, I have a question up at the top. It says, which part of the cardiac rhythm does the nurse analyze to assess the integrity of the AV node? Okay, the student answered A, and it was which is P wave, and the correct answer is the PR interval. Okay, so from the test analysis form, this is what the student chose. I don't remember if what student it was, but they said it was a careless mistake. And so when I inquired, I said, well, what do you feel like you were careless about? Did you miss something in the question? Did you miss something in the four selections? The student's response was, I thought it was the P wave because it is when the atria contract. Okay, so what I found is that the student was not just being careless, that the student really didn't understand the concept. Okay, that the PR interval is really about the atria contracting and the AV node catching that impulse to slow it down. And they didn't understand the concept. Although they think it's carelessness that they missed it, or they'll say, I knew that, and I just didn't choose the right one. Well, how come you didn't know it, And they'll say, well, I thought it was this. Well, that's not knowing it, It's getting it a little bit confused. So either they are having a memory issue or they're not understanding the concept. So I explained to the student, and and I didn't mark the no area. So I just on this form back here, it says never studied, did not know area, number 11. So the student can have more than one of the 1, 2, 3 reasons of why they missed a question. That's another thing that I have to sometimes explain to the student, is that you can have multiple reasons why you missed a question. So anyway, so I go over it and I mark it that really it wasn't carelessness, but I don't mark that out because that's what they thought. So I say, okay, but it was also that you didn't know the area. And so what I tell the student is that review the material and I'm going to orally quiz you about, the EKG process or the telemetry process in clinical, so that they're aware that, hey, I'm not going to just stop here. That reviewing the material can be done in lots of settings. So we're not going to see this question again on another kind of test. They're not going to be quizzed on this, but they will be in clinical orally. So that continues their learning. Okay, here's the second example. The nurse is caring for a client who is placed on comfort care. Which intervention should the nurse provide? And this is a select all that apply. And if your students are like mine, they hate select all that apply. But we all know as educators that select all that apply are very prevalent on the national exam. So we do give them and we let them know that there will be some on there. Again, expectations, explaining to them this is not going to be a shocker to you. You know that these kinds of questions are coming. And so looking at the example here, the student answered A, C, and D, and the answer was C and E, okay? So when I asked the student, I said, okay, so you got, two of them. Well, you got one right. What happened to the other one? And the student's response was, I didn't trust my first impulse. I knew that's what it was, but somehow I talked myself out of it. Well, pardon me. When I talked to the student about it, I asked them, what holds them back from the lack of trusting themselves? There's something back there, that's causing them to hesitate, to go ahead and click those ones that they know and go on, and a lot of times they'll say things like, well, I always miss these kinds of questions, or, well, I remember one time I answered, I saw this, I saw that, turning the client every 2 hours is true to prevent skin breakdown. Well, yeah, but not when they're in comfort care, remember? We're not trying to prevent a lot of things in comfort care. And so then they go, oh, yeah, that's right. I thought about that too, but I just didn't. I thought, no, you always want to do that. So see, they just have a lack of really trusting themselves in their impulses. They talk themselves out of the right answer. So, I encourage them to trust themselves. I do things like I cover up the answers and I ask them to, answer another question that may be in the same content area, and they're able to tell me exactly what the concept is about or the question is about. Sometimes students need an authority to tell them what to do. So I tell them, place a sticky note on the computer screen somewhere that says, trust thyself, trust yourself. You know this information, you studied it, you've done all the recommended things that faculty have told you to do, and you know this stuff. So trust your impulse and go on. And usually, if they don't linger on the question, they move on, they get the question right. And if they see that progress and they see that outcome, they're more likely to repeat it. Okay, third example. So here's a question here. What is the initial intervention in a patient with sinus tachycardia with these vital signs? And as you can see, there's a vital sign, and they're on oxygen. And so the student answered C, which is attempt or encourage patient to induce the vagal stimulation. And the correct answer is B, all right, identify and correct the cause. When I talked to the student and looked at their test analysis form, I looked at it and I said, well, what did we see here? And she said, I didn't think or saw very well. I didn't look at all the data. I didn't look and say, oh, okay, I didn't recognize that the patient had a temperature, or I didn't know if it was, or I didn't realize it was an oral temperature. They come up with some ideas. So here's some recommendations that I give the student. I review the question with them again. I remind the student why the patient could have sinus tachycardia. So again, you go over the concept, you talk about the causes of the symptom or the sign, and then explore the patient's thinking. Student's thinking. So I think about, do you know what sinus tachycardia is? What is, what are the characteristics of that? That kind of thing. And then a lot of times I find out a lot about the student when I explore their study habits. So I say, okay, tell me what you've done in the last week to prepare for this course. And a lot of times they'll say to me, well, I just started studying 2 days ago. And I'll say, well, it's real hard to be able to, digest and synthesize and analyze the amount of information on, I teach a senior class. The information here in just a couple of days. And so they kind of look at me like I'm strange or I have three heads, and they're saying, well, are you trying to tell me I'm not smart? And I'll say, of course not. No, not at all. But when you're a novice at something, you need even more time to be able to digest and analyze the information. So I encourage them to back up their studying, to at least a week, if not 2 weeks. They should somehow every day pull out this information and review something, be it, NCLEX questions or case studies or their notes or the text. All that stuff is there, and it's there to support their learning and showing them how to. It's either a scheduling issue or they are working more than they really want to work, but they need the money, and that might be a whole problem there. Um, Sometimes you can find out that they have other people depending on them for finances and that kind of stuff. And I'm sure many of you have run into those problems with your students and have explored areas to help them manage all of that. Well, again, study habits and all those things come into play in trying to explain to them and work with them on, a calendar and scheduling their life can sometimes be the major blockade, even though they've been in college for 3 years or 4 years. They just never had to be this detail oriented. Okay, so sometimes when they don't think, don't problem solve, it's really about the fact that they didn't have enough time or didn't spend enough time really studying the material. Okay, so if the student marked, these are trends, and that's another thing. On the form, you kind of look for, do they have a lot of questions where they didn't trust their first impulse? Do they have a lot of questions where they, misread the question? Are there a lot of checks or X's, however they mark it? Is there several of them in a row, or do the majority of the things that they've missed have the same reason? So a trend, especially in critical care, and I'm a critical care nurse, those are really important to us. We look at that to decide what we need to change. Um, so here's an example. If a student has misread a question and missed keywords and marked carelessness, it's very possible that student may have a reading issue. I mean, it may be dyslexia, it may be a reading processing problem, and I can't diagnose that. So I tend to tell them, look, you're missing. These are the reasons why you're saying that you've missed these questions, and it seems to be that there's a lot of them in a row here. So let's, stop and let's think about what has your history been when it comes to reading in high school or earlier college. What have you had to deal with? And a lot of times they'll say, when there's large volumes of information, it's very difficult for me to prioritize or very difficult for me to read all of that. I don't consider myself a fluent reader, those kinds of things. Had difficulty in school when I was in high school or whatever. And it may be that, it's a problem then. They didn't either do accommodations or were never tested or had accommodations but never took them. Or maybe they were on medication for attention deficit, and when they got in high school, they stopped using it, and they've learned to compensate, and it worked okay there, and in the freshman year of college. But then as things get harder and harder, they find that they are unable to focus, they're unable to see certain things whenever they're taking an exam. So you explore those things and say, okay, well, maybe we need to look back at the diagnosis portion. And, I refer them, I send them to our counseling division here at SFA. We have a counseling area for students, and they can make referrals. I send them to our disability services, and they can also give them a list of different people within the area, different agencies and physicians and psychologists and people like that do testing. And if they can get it done, they can get it done in a semester, it's great. A lot of times they can't get it done in that semester, so they tend to not be very successful if this is truly their problem. Or they somehow compensate and they get better. So they're usually my students that are right on the border. Okay, they're right on that 73, 74 line of being able to pass the test themselves and the course. So they struggle. Okay, I've had students that have had processing problems, meaning they can read the material and just can't really comprehend it, can't really see where I'm supposed to apply what it's saying. And in investigating and visiting with them, I find that they have the same problem when they read, To Kill a Mockingbird, or when they were in geometry. They have spatial issues in their reading ability. So again, those are things that I have to refer out, and hopefully they can get the help they need within the semester. A lot of times it's the next semester. I just follow up with them. I follow up with them and say, how's it going? What's been done? Where are you on this process? And ask them, where are you? Where are we going to go? How close are you to getting, accommodations through disability? So, it may take time, and unfortunately, sometimes students have to repeat the course, but they come out better in the long run. Okay, if they're not using tools such as highlighters in the exam, I point that out. Remember, you can use a highlighter in the exam and on NCLEX to point out keywords. That's a tool that they can use to help them point out those things and decrease their carelessness. And I have found that some students that use those do pretty well. They do pretty well. It can help them compensate until they get further, testing and diagnosis and then accommodation afterwards. Okay, so that's that. Here's a couple of other ones. If the student marks the majority of these issues, like defined the problem incorrectly, did not think or problem solve, drew wrong conclusion, did not use testing techniques, I found that students sometimes have a processing problem, which we talked about. They may not use the deductive reasoning process very well, and I've had to explain that to them. I've had to talk to them about, okay, well, if when you put the water on to boil and it's not boiling, what might you check? Okay, and then they think, well, what do you mean? Maybe the burner's not on? And I'll say, yes, maybe the burner's not on. Maybe you thought you turned it on, but it's not. So it's deducting and kind of rationalizing why are things not working and troubleshooting with them, because they've never had to do that. There are many, many students that we have that have not had to troubleshoot for themselves. Okay, so taking them through that deductive reasoning process. They may need to learn how to strategize and take a question apart. They may need to see that, the question gives them a lot of information. And maybe they need to take that, we use that test analysis form. They can flip it over and they can use it as their scratch paper, okay? They flip it over and I say, okay, write down a box over here that has vital signs in it. And you write down the vital signs that are on that question. So then you've taken that out of the formula of what you've got to read. And there is this learning style that some students tend to do really well with, which is they read it and then they write it, and it becomes more a part of their synthesis ability. So once they write it down, it's like it sticks in their head, and they're able to look at the rest of the question and take it apart and be able to answer the question. And the more they do that, the more of a habit-forming test-taking strategy it becomes. So teaching them about how to take the question apart and what's important and what's not, sifting through it is a very good way to work with these students. Okay, these students, the second bullet is very important. These students need lots of practice in test taking. They may be the weaker in one area of nursing and do really well in other areas of nursing, okay? Usually they have concepts that they struggle with. One of the things that I have learned from my mentors is that concept mapping out a disease process is really helpful for these students. It takes them a long time to do it. They kick and scream the whole time they're doing it. They probably knock on my door 2 or 3 times to get help because they get stuck. But after they do it once, it's like a light bulb comes on and they're like, oh, I now see what I have missed. Somehow their thinking has missed a link in whatever that content is that they're struggling with. And that concept map helps them pull out all the links and see where the one is that they've missed. I've seen it happen over and over and over, and so I'm pretty sold on it. I've not had a student yet that has come back and said, this didn't work for me. Okay, so if I get one, I'll definitely share that with everybody, but I haven't found one yet. So it has really helped them solidify what it is that they're missing in that content they're so weak on. So they do require a lot of practice. They do require some time from our part. I have to say that there's not a whole lot of students that are here. I would say we have a class right now of 78. I probably have 7 of them, but there's 4 of us, so we can spread that out. We can spread the love, as I say, and we can help those students a little bit more because they need it. They need it more than the student who is really doing well and not struggling in our course. Okay. I do recommend for these students on their break time after the end of the course, and I've talked to them several times, and we've gone over material, and we've become pretty much good friends by this point. I recommend during the break that they do some kind of review course, especially in May if they're a May person, if they're out during May, and if they're not, that they take one in May. They're going to have some holes in their content. They're going to have some holes in their thinking. It's not going to solve every one of them, but the review course will really help them lay out the content and help them remember what's missing. Content remediation is kind of what I was talking about earlier with the whole concept mapping. And then NCLEX type question taking. So we use different kinds of NCLEX books and NCLEX software that really gets them in the mode of taking the NCLEX. And I tell them, the SAT was really hard when you first took it. And a lot of test taking is strategy. Yes, you have to know the content, no doubt, but you also need to know how the test maker is making the questions, and so that you can navigate through that. So the better you know that, the better you can overcome that hurdle. Okay, here's another trend that I've seen. The student marks didn't trust my first impulse and changed my answer. I talked about the impulse one, changing my answer. A lot of times that also has to do with trust. This student is not confident in their own knowledge. They don't trust themselves. They're not confident in themselves. They may be these are students that's normally excellent in clinical. They know exactly what to do. Patients short of breath, they know exactly what to do. Patients bleeding, they know exactly what to do. They have a patient that is about to fall, they know exactly what to do. They are perfectly good in clinical. They're absolutely wonderful. They're probably your best clinical student. And many of you probably know exactly what I'm talking about. And then when they sit down for an exam, it's like all that confidence is left at the clinical site, or it's in their backpack at the front of the room. I don't know what happens to it. And I sit down and visit with them. And I say, God, you're so good with all these patients we've had, and you've shown this, you've shown that, and it's glowing. But why are you making a 73 on these exams when you know the material, you know the interventions, you know the processes, you understand the content and the concept? A lot of times they just say, well, I'm just not sure when I'm sitting there looking at the question. So, I encourage them to, what I'll do is I'll say, okay, we're going to take this concept. Let's say I'll take pancreatitis. Let's say that. And I'll say, faculty just went over that in lecture. And I'll ask them some questions about it. And they can answer every verbal question I give them. Okay? Then I say, okay, I just gave you a test question. I just gave it to you verbally. So why is it that when you read it on the screen, you choose the wrong answer? And they'll say a lot of times, oh, gosh, I didn't know that was a test question. So it's the whole concept and attitude about, gosh, that's a test question, therefore they have this barrier. So I tell them, most of the time they get what we're talking about correctly. So I help them see, look, you do know a lot of information. You do have what you need to pass this test. You just need to trust yourself. You just need to have confidence in yourself. So it shows them that they can answer it correctly. And I also encourage them to say, if they have that authoritarian thing where their parents have always told them what to do and how to do it, there are many students that we work with today that have that mindset. They've had parents that did everything for them. Okay, I tell them, okay, well, I'm going to be your parent. You say, Miss Logan said, do not change your answer. Do not not trust I am going to trust myself because Miss Logan said I could trust myself. If that's what they need, as elementary as that sounds, it really helps them overcome that barrier. Okay, if a student says this, well, I read into that question, and I'll say, well, what are you talking about? You read into it. What does that mean? A lot of times students will say, well, I thought maybe the patient had this on the other side of their leg where the bleeding was, or maybe you were talking about a hematoma underneath the arterial line and you were wanting us to kind of figure that out, or we were assuming that this was going to be going on while the patient was doing this exercise. And I just say to them, I'm not here to trick you. I'm not here to make things difficult for you. I'm here to help you succeed. So I wouldn't give you a question where I don't give you all the information you need to answer the question. So don't go into a question with the premise that I am trying to trick you, okay? So once we get over that hurdle, they'll say, well, okay, well, we'll look at another question. And they'll tell me, well, in clinical, we did it like this. Or I saw the nurse do this in clinical, and so that's why I chose this answer. And I'll say, well, the question wasn't taken in clinical. We weren't in clinical when I asked you this question. You were in a classroom with a question. So you didn't have that information before. So I try to get them to see, look, this isn't an experiential question. It is what it is. You didn't take it at face value. So I tell them we're not in my course number is 406. We're not in the 406 hospital, okay? I'm sorry, I tell them we are in the 406 hospital. 406 has everything they need. The doctors call them back on time. All your supplies are available. You've got lots of staff to help you do whatever you need. You always get a hold of the respiratory therapist or whoever it may be that you need assistance from. You never run into those problems like you may in the real world, in clinical, where you may have to adjust a little bit. In testing, we're not doing that. This is exactly what the question is exactly what it says. So I tell them the same thing, whenever they're in community. I don't teach that, but I tell them, if the question is what it is, you take it from that. You don't say, well, when I was doing the disaster drill, this is what happened. Well, it doesn't matter. This is the question itself. And a lot of times they'll tell me, well, my grandfather had a heart attack, and this is what they did. Well, okay, but that's not what the question's asking you. So I redirect their thinking, redirect what they're thinking and what they're actually talking about. And they'll have these little rabbit trails they run off in their minds, which eats up their time on the test, which is a big deal. And then they're including information that was never intended to be in the question. Okay, so I really stress it's not what you have experienced. Okay, it is what is in the stem of the question and what your selections are. So the student may want to ask, well, if the blood pressure was this. You've had students that say, well, what if this happened, and what if that happened, and what if you left out this information? Well, I just tell the student, show me in the question where that information is. Where does it say that? And most of the time, it's not there. They've fabricated it, or they've thought it up in their mind, and they think they see it, or, like I said, they go on that rabbit trail, and they're over there, and they answer the question based on that. And I have to tell them, look, you got to come back and read the question for what it is. And usually, if they do that several times, they will train their brain to not go off that way. Okay, some tips to help students. Anxiety, it is huge and it is real. For many students, a little anxiety is good, as we all know. It does help us stay awake, helps us our mind to be sharp, that kind of thing. Paralyzing anxiety, where they're having, sweats and like they feel like cold is running through your veins and that kind of thing. That is, symptoms of severe anxiety, as we know. And really, we need to talk to the student about, where are you going to go to get this under control? And that may be a physician's office, that may be a counseling office, it may be a psychologist's office, it may be a lot of things. It may be relaxation techniques, it may be a lot of different things that can control anxiety. A lot of our students are very much like our patients. They don't want to admit that they have mental issues, or mental health issues that we all have to deal with. We all suffer from anxiety in some form or fashion. It just depends on what we are anxious about. And most importantly, it's how we cope with it. I'm trying to teach the student that everyone experiences anxiety, but how does that person deal with it? If they know someone of their peers that you see has anxiety, or maybe has expressed that, ask that person, how do you look so calm whenever your heart rate is, 102? And they'll say, getting experience that way, having them go to, a support group within students themselves, of sharing one another, the ups and downs of nursing school can definitely help them deal with and cope with anxiety. So I've had to teach them, I've had to teach them coping skills. I never thought that I would use my psychiatric nursing as much as I have in nursing faculty, as a nursing faculty member, as I have. Really, many of them have very poor coping skills. Many of them have none. Okay, I found that, and that may not be true for every population. As far as having none, I think, or having poor ones, maybe they just don't know which ones that work and which ones don't. But from my experience, a lot of them either have very poor coping skills or they don't have any. They have a lot of negative self-talk. They have a lot of experience, not a lot, but they've had experiences where they had one negative experience and they let that overshadow all the others. So trying to get them to say, look, that was one learning experience. Let's move on. Okay, teaching them how to replace that negative talk with positive, encouraging words, which is the next point. If they need to make encouragement cards, I let them do that. I don't let them bring them to the test. I might let them put it on the sticky note or on their scratch paper. They can do that. But, having those encouraging words to retract or reset their teaching, their thinking, can often help the student. The student will say to themselves, they'll go through a question, and they'll go through the next one, and they'll think, gosh, I should have clicked whatever on that other, I should have clicked B instead of A. So, they'll beat themselves up about that. So I tell them, look at those encouraging words over there. You got to trust yourself again. You got to get that confidence back. So that's the purpose of those. This last one I have found to work really well for students who are just can't seem to turn their thinking around, and they need something physical to help them remind themselves. And what I tell them to do is wear a rubber band around their wrist. And when they think something negative, they have to become conscious of their that helps them say, oh, wait a minute, I'm going down the old way I used to be. I want to try this new path. And I help them see that. Another thing I do is I would encourage them to tell someone what that rubber band means, and especially the friends that are close and they can be transparent with. Then the friends can help them also. I don't recommend that for all students. Usually, I haven't recommended it in several semesters. I haven't had a student that has really needed that physical contact, but I have had a couple, that have needed it. And I mean, that's not the only thing they do. That's one of many tips that they use, or I encourage them to use. But it does help them, in that aspect. Use of aromatherapy. We have a faculty member here who is doing research on aromatherapy, and she has gotten the students, clicked into this, and they have really enjoyed. The ones that are doing it, not everyone does it, but the ones that need it or feel that it is helpful to them, they use it, and we allow that. Our faculty member replaces the aromatherapy oils, and she replaces the paper, and we work with her and make sure we bring it to the test. And the students have anxiety that's decreased by wearing it, or using the piece of paper that smells. Um, some of them use the aromatherapy to help them be more alert and be sharper whenever they're reading the questions. So the use of aromatherapy has helped several of ours. Use basics. You guys know this far more than probably I do. Sleeping well before an exam, eating well. And I encourage my students, don't sit there and quiz yourself before an exam. You're not going to remember what you're trying to remember in the next 5 minutes before the exam starts. I tell students, or I encourage them, to come to the test without notes. I tell them, look, you're going to look at those notes and you're not going to remember anything that you're reading, because what you've got in your brain is already there, and you need to apply it to the test question. So there's no need to bring test notes. All it's going to do is, a lot of times what it does is make them more anxious about what they're doing or what they're going to be tested over. I let them and encourage them to wear earplugs if they are easily distracted by others. And when they take NCLEX, they are usually in a room by themselves, or they're in there with one other person, I believe. So, they're not easily, it's not as many, you have 78 students in one big computer lab, people are getting up and coughing and moving and sneezing, and all of those things that we do as humans can tend to distract some students. So use of earplugs can help them. This point right here, encouraging them to practice or do a mock test the night before. I've had them do that. That helps them. I've encouraged them to do that. It helps them reduce their anxiety about the upcoming exam. I try to help them to set up their area where they're going to be doing this mock test as close to the testing situation as possible. They can go and that way they can get different softwares that drill down to the topics that they're going to be tested over, and they can choose those questions. And I just tell them, answer them, and then go over the rationale, and that's it. You're done. And then go to bed. So a lot of them have done that, and they have self-reported to me that it did help them. If they struggle with drug calculations, and I'm sure some of your students do as mine do, I encourage them to practice them every day. I also encourage them to wake up and do at least 3 drug calculations the day of the test, because that will help them decrease their anxiety about them, and they've got a well-greased oil on how to do those drug calculations. They don't worry too much about, oh gosh, how do I do this and how do I do that? How many milligrams is in a microgram, how many micrograms in a milligram, and all of those things. So once they kind of do 3, they tend to feel like, okay, I can do it. Then lastly, I tell you, don't give up on them. Many of these students have huge hurdles to overcome. I was talking to one the other day, And she explained to me that her father's a non-recovered alcoholic, and he attempts to commit suicide at least once a semester while she's in school. And I was talking to her, and I said, Doc, what are you doing for you? How are you handling this? And she did tell me that her dad was in treatment now, and her mother was, separated from him, and they are working it out. And she avoided the question. She told me what everything else was happening. And I brought it back to her and said, listen, I said, I want to know what you're doing to deal with this. How are you coping? Who is it that you're going to talk to about this stuff? And finally she said, well, it's been recommended that I go to counseling, but I really just talked to my sister about it. And so, you meet them where they are. It's not all, relationships are messy, as we've heard, and we know. So as things went on, we just kind of talked about the fact that the expectation of clinical is that you be there. And if you have to miss, then we'll make it up. But letting her know that she does have a support system, and she does have faculty that will listen to her, and that she, can, pass the course and pass these tests in spite of some of these huge things that are going on in her life. Many of them are overwhelmed with low self-esteem, poor self-image, and have not had anyone in their life before you to encourage them. Believe it or not, there are a lot of kids out there that, that are in nursing, and they want to help others because they need help. They kind of transfer that stuff over to their patients. So, you have to kind of look at them and say, okay, where are you on this? Where are you about who you are and where are you going? And so a lot of times asking probing questions and asking them, how much are you partying outside of work, outside of school? How much time are you really spending, in your social areas as opposed to studying? And why are you doing that? What's going on that makes you feel that you need to spend so much time doing those things? And a lot of times you can get some very insightful information if they're honest with you. Obviously, they have to be honest, and you have to have a rapport with them just like you do with a patient that you're asking probing questions with. But I have found that if they know that you're there to help them be successful, they are more likely to disclose their heart to you. Okay, I have to say that many of these students that we care for or, teach are products of parents they have parents that did projects for them. They didn't have to go shop for the materials. They didn't have to put together. They didn't have to process anything. They didn't have to troubleshoot. They didn't have to figure out why something didn't happen. They had parents that plowed the way for them, even are trying to plow it now, but the only difference is now is that nursing school is so different that the student is like, you can't help me with this. There's no way for you to step in my shoes. And they actually have overseen their educational path all the way through college, and I have a student that is got a mom that's still trying to direct where they go and what they do. So now they're left without the rudder to guide the path. So the faculty member is dealing with someone who has a handicap, and that's how I kind of look at it. They've got a disability, and we've got to teach them how to overcome that. And it's a rewarding thing, I can tell you, and I'm sure you've come across students like this. And but letting them know that they can do it, they will do it, and they are capable and they are smart, and we can give them coping and strategy to help them succeed. So they just learning to trust us. So all those things to say that all that stuff will help them remediate and hopefully do better on the next exam. So thank you very much. They are, the future of nursing. They are going to be caring for us as we age and become side of the bed. On the other side of the patient's bed, we will be the patient. So, you know, it's in our best interest and in the healthcare of all others to teach them well and help them get as, you know, as competent as possible. So I appreciate your time today, and I hope that you all have a good afternoon. And that is the end of my presentation. Thank you.
Wonderful. Thank you so much, Laura. We're going to go ahead and open the floor up for a quick Q&A session. If you do have questions for Laura, now is the time to pose them in the questions area of the GoToWebinar control panel, which should be on the right-hand side of your screen. If you'll type them in there, we're going to read them out. We have time for just a couple questions this afternoon. I'm going to go ahead and get started, Laura. We do have a couple already in queue. The first question is, can you explain the process of retrieving student progress data from the exams?
Student progress, student what? Progress?
The process of retrieving student progress data from the exams. I think this person's not familiar with ExamSoft and how it works specifically. Could you go over that?
Oh, sure. If you go into assessment, you go into that tab, and this is how I do it. I go into assessment, I click on the assessment itself after I've given the exam, obviously, and then you can click on reports, and reports will give you a list. It gives you a summary report, it gives you exam taker results, it gives you student progress, I think, and then it has strengths and opportunities. I click on strengths and opportunities, and then the next screen that shows up is, what do you want to show on that? It'll ask you, you know, things like, if I can remember, it'll show you things like, do you want the name of the question, like how you named it, or the number? It'll ask you, do you want the question content? You want the items, you know, the selections, the different kinds of items, the ABCD, the distractors, however you want to describe that. It'll ask you if you want the rationale. It'll ask you if you want the grade percentage, how you want it, you know, raw data, points, whatever you want to do. Then it'll ask you, you know, you can click on whatever boxes that you prefer. I pretty much click on almost all of them except the statistics, because I'm not going to show that to the student. That's a separate report, and that information is between faculty in our facility. So I pretty much show them, you know, the question. You know, I only show them the ones that they missed. I don't give them the entire exam or go over the entire exam. That would just take entirely too much time. But I do the ones that they did miss. I hope that helps. I would encourage you to contact your ExamSoft person, for lack of a better word, your contact there. They can definitely walk you through it if that didn't kind of solidify for you.
Perfect. Right. If you are an ExamSoft client and you need help with any of the actual logistics of walking through this process, I would encourage you to speak to your account manager. If you are not an ExamSoft client and would like a little bit more background information on how the actual embedded assessment process works, we're going to throw an email address up on the screen here in a little bit. You can shoot us an email, and we're more than happy to set up a demonstration for you. Laura, the next question is, I like the test item analysis idea. I have done this informally. Do you give the test questions to the students? If yes, then you need to create new tests each session?
Okay. I don't give, I give them the form, the test analysis form. We give that to them every exam. And no, I don't change the questions. They're the same questions over and over and over. Whoever created this form obviously did, you know, realize that these were the most common things that students said whenever he or she remediated the student. So I think that's where those items came from. But they are, you know, I haven't found. Occasionally they'll say something that's outlying there that aren't listed 1 through 11, and that's why that other is there. And we'll put it, you know, have them describe it on that one. But like I said, I give it to them every exam, and they flip it over, and they can use that as their scratch paper. Because at NCLEX, they get a whiteboard and they get a scratch, that's their scratch piece of paper. So they can write what they want on there, okay? So it's very simulated to the actual national exam.
Perfect. Next question is, any suggestions for remediation after a student has failed an entire course?
Wow, that's a great question. I'm working on that. You know, with this semester, I have our faculty team has 5 repeaters, which has been the most we've ever had since I've taught the course. And I have had a group of them come to me. You know, 3 out of the 5 come to me and say, "Do you have any suggestions for us?" And I had to really think about it. You know, I gave them some things some tips that I've given in the past, which are, you know, they need to spend every waking moment eating and breathing this information, because this is their one chance in our facility and probably at yours too. They can only fail a nursing course twice, and then they're no longer allowed in the program. So they're dismissed. So, you know, I realize this is their last chance. So I really, I tell them to eat and, you know, spend the majority of your time doing this. They also have to take, at our facility, they have to take a remediation course. And what that course is that instructor works with me or whoever the faculty is that has that student in the repeated course, with, you know, what is it that the student is really struggling with. And it may be a lot of things, right? And we converse with that, and we try to find specific. It's almost like an individualized educational plan for that particular student. And it can range anywhere from, this is how much time you need to study to make this grade. These are the areas that you need to do your NCLEX questions on. We look at their past, we do into the course HESEs. We look at that and say, okay, these are the areas where, you know, the HESE exam has drilled down and said you need to concentrate on. We go over that with them. So those kinds of things, along with these tips that I gave you on this presentation, are some of the things I have done in the past. Concept mapping is huge, in my opinion, especially for those students. I just graded one of their clinical assignments, and I see that there's some big holes in this particular student's thinking, and I'm going to have to work real hard with them to kind of fill that in. So I hope that helps. Those aren't, you know, 100% for sure, but they do help. In the past, they've helped with other students to come through. But that's kind of my next project, trying to figure out what is it that can really remediate them for the course itself. That's a little bit bigger of a project than the test, individual exams. But good question.
Great. Next question is, do you have any tips on how to establish a successful category or tagging structure?
Well, I talked to my other faculty people, my other faculty peers, and they help me. I also go to my mentor, and she helps me out with it too. Basically, I think what you can do is look at your text and then look at how they break down the information, and that may be a model to use. I haven't researched that. That might be something that, you know, some educational person that's far smarter than me has already done and thought about, and there may be some models out there that we can, you know, mimic. That's a really good question too. As I said, I hadn't really drilled down my questions yet. That's one of the goals I have this semester for our overall course. So I'm definitely going to be looking into that. But what I have done in the past with the same course but a different testing software, we drilled it down to, you know, like I said, a cardiac question. If it was a drug question, then it's in drugs or critical care drugs. And then I break it down to vasoactive and vasoactive drugs, and then vasoconstrictors to vasodilators. So you can go, what is that, 4 or 5 subcategories, and then is that a calculation question or is it a mechanism of action question? So is it a side effect question, that kind of thing. You can tag it down, as far as you want to go to really see what your student is struggling with. If you want to capture that kind of data. I think, you may want to check with another thing you might want to look at is thinking about your agencies or your institutions that oversee you, like AACN and ANCC, sorry, and NLN, and I know those two people are not together anymore, but anyway, those folks, and then maybe your overall university, like the SACS, the Southern Association of Colleges and Schools. They oversee our, regulation and expectations. So they may have some suggestions on what they want you to capture, and that might be a starting point, and then you can go from there. That's what I did. That way you'd be killing 2 birds with 1 stone, is why I was thinking that.
Great. Next question is, how do you handle students who have issues with English as a second language?
Another great question. Difficultly, I have to say. I had a student last semester who is Chinese, been in the United States for about 13 years. Should have acculturated by now. It usually takes anywhere from 5 to 7 years to acculturate, usually depending on how old the student is. The student graduated from a high school in Texas, has a very difficult time, not necessarily talking to me, but talking to his peers, but talking to patients. And I found that patients become a little bit more frustrated with him than other students. So it's been a little difficult at times. I've had to be in there a lot with the student. I had to talk to this gentleman about, what are you going to do to help your patient feel more comfortable with you? That's the hurdle that he needs to overcome. And he has told me that he, is going to be doing some volunteer work so that he can interact with people in general, and not just handing out water, but actually sitting down and playing a game of checkers with them, that kind of thing. Real basic cultural aspects of interaction with the student and the patient, or in the population rather. That's one thing that, and I talked to him this semester, and I asked him how things were going, and I don't have him anymore, but he's going to graduate, we hope, this semester, in December. And he told me that that volunteering helps a lot, and that he realized that he didn't know a lot of colloquialisms and that kind of thing of East Texas where we live. So he has, he's taken more and more suggestions from us as he's seen that those things have helped. And it's not just me suggesting them. There's been other faculty that have helped him, become more acculturated in East Texas and in Texas itself with the population, because he'll be living. He's not from Texas, but his family lives here. Kind of close to the Houston area, so he will be interacting with those with those patients. He interacts pretty well with his peers, but that has taken a while. It has taken quite a bit. The other thing is you may want to look at your university's clubs that they have and encourage them to go see other cultural aspects of other than their own. That I've encouraged them to do that also, to go into the international cultural studies, and they actually have meetings and things like that that help those students interact with Americans and how to navigate the waters. And as far as testing goes, it can be a struggle, but you know, having English as a second language is not considered a disability for ADA. So, you know, I have to, you know, stress to them that they, you know, need to learn the language before they can really do well in nursing. So they, you know, they struggle a bit, but some of them have, you know, taken English and take it again and do really, really a lot of work on the English language itself and come out on the other side. So, you know, I've seen both sides. I've seen some that struggle and just never really get it and unfortunately don't finish the program. And then I've seen others that, you know, have really dived in and do extra things to learn English and learn the meanings of words and medical words and all that. And they come out okay. I hope that answered your question.
Great. Thank you so much, Laura. That is all we have today, everybody. Really appreciate Laura presenting and taking time out of your busy schedule to share your experiences. And for everybody else taking time out of what I know is a busy week to come and listen. Folks, I just want to reiterate, I had quite a few people ask if the recording, you know, if we're recording this and when that will be available. We did record this webinar. It will be available and up on our website within the next 48 hours-ish. As soon as it is available, we'll email you a link so you can shoot that way and take a look at it. So that will be available. You can share it as you like. Also, as soon as you sign out of the webinar, you will get a quick survey that will pop up for you. Just a reminder, we really appreciate everybody taking the few extra seconds. It's just 5 questions long to give us any feedback that you'd like on the content today, just so we can continue to provide relevant presentations for everyone. With that, I'm going to go ahead and wrap it up. Thank you all so much for being here. Thank you, Laura, for presenting, and everybody have a great rest of their day.
Thank you.